My name is John Wilks, and I'm the author of this book, Choices in Pregnancy and Childbirth, which came out in August 2015. My background really is in helping mothers and babies during the process of pregnancy and after birth, working on babies with various kinds of problems like colic, not sleeping well. And I've been doing that for about 20 or so years now, working at a clinic in the southwest of England. So I feel very passionately about this work. The idea about this book really is to put it in a format which is quite concise, very factual, but also very positive about what mums can do if they want to support themselves and their baby in as natural birth as possible. So when it comes to what choices mums have and dads have in pregnancy and childbirth, it really all starts very, very early on, actually, and that's one of the things I wanted to stress in the book, how important it is to prepare both psychologically and physically, not just for pregnancy and childbirth, but actually also for conception as well. There's a lot that happens in the very, very early stages of pregnancy, in the first few days, actually, which are really, really important, which are impacted by lots of different things. So one of the things that the book focuses on a lot is what choices mums and dads actually do have in pregnancy and childbirth. Choice really starts very, very early. The choice to become pregnant, yes, the choice for a baby, if you're looking at it from the baby's point of view, to incarnate. And what is important really is to look at some of the impacts during those early stages and how important it is really to prepare for pregnancy. So we talk in the book quite a bit about womb health, nutritional aspects, what mothers are exposed to. There are many things in the environment nowadays which mums are exposed to, which they weren't 50 years ago. And some of these things have a very profound effect on the baby. Some of those effects last all the way through pregnancy. Some are more prevalent in the very, very early stages, some more later on. And so those are discussed in the book in quite a lot of detail because this information is actually very, very difficult to get hold of. One of the things that I didn't know much about at all, and I had to get a lot of help from Professor Vivian Howard, who's a toxicologist who used to work at Liverpool University. But one of the things that he talks about, and he did a report actually for the World Health Organization on this, was exposure to tiny particles, nanoparticles, which are quite ubiquitous nowadays in our environment. You find them in all kinds of things from coffee creamer to chewing gum to suntan lotion, even on the surface of things like washing machines. And some of those, the effects of those particles are really unknown. There are a lot of scientists now are expressing some real concern about their effect, particularly during pregnancy. So the book goes into a bit of detail about that and explains exactly why we have to be a bit concerned about it. But primarily the whole idea about the book is to be positive. And so, how can you avoid exposure to these things? How can you minimize the risk of exposure to things like pesticides and herbicides in our environment, because those things are definitely linked. Through the research, it's very, very clear. Exposure to pesticides, herbicides, does lead to more problems for the baby. So there is quite clear research now on the link between later health and exposure during pregnancy. So for an example, a lot of people think that cesareans are a positive and easy option for childbirth, which they can be, and they can be a necessity in certain situations. However, in our culture, cesareans are used probably much more than they should be. In the UK, it's something like 30% of all births now are cesareans. In places like London, for first-time mums, it's more like 45%, which is very, very high. Cesareans do have ramifications, both for mother and baby. So, for example, a lot of cesarean mothers or mothers who given birth through caesarean section have more difficulty bonding and attaching with their baby after that kind of birth. One of the things that's attracted a lot of research recently is the whole issue of what is called the microbiome. And there's a whole chapter in this book written by a doctor, Carolyn Go, about this. And so what happens when we are born normally, when we are born vaginally, is that the baby is exposed to the beneficial flora in the vagina. And that has the effect of kind of seeding the baby's immune system through the exposure to a diversity of bacteria. And this is what seems to be important, is that the type and diversity of bacteria that you're exposed to at birth then seeds your immune system, and that then goes from generation to generation. Some of these things are incredibly important in terms of, our future as a species. A lot of these factors, the exposure of things like pesticides, herbicides, nanoparticles, and the seeding of our microbiome really have an effect through the generations. It's often said that we are what our grandmother ate, and what our grandmother ate had a big effect on how we developed. So these things are very, very important. This book is very much looking at what it's like to be born from the baby's point of view. And most pregnancy and birth books tend to stress what it's like from the mother's point of view, which is also obviously extremely important. I wanted to focus more on the baby's point of view because there's a lot of things that perhaps we don't think about. In our culture, we tend to think of babies as being lacking in refined consciousness. Perhaps if they experience a difficult birth, if they experience pain, they won't really remember it. For example, it was common for babies to be operated on without anesthetic. They were given a muscle relaxant so they couldn't move. But this was done in the best interests of the child, because there are downsides of sedating a baby with anesthetics. This whole idea that, so you can do these things to a baby but they won't actually remember it, really has been absolutely proved beyond any doubt to be completely false. So, but even then, nowadays we often circumcise babies without anesthetic or very, very little anesthetic. But there have been studies on exposure of babies to pain, and this has mostly been studied through circumcision because it's so prevalent. So if a baby is exposed to pain early in life, and this would include at birth or shortly after birth, or certainly in its first few months, then it's much more sensitive to painful insults. So experiencing pain, it's much less tolerant of pain as an adult, which is very interesting because nowadays we have a whole raft of chronic pain diseases, which the NHS are finding incredibly difficult to work with and very, very expensive. You probably know lots of people with chronic pain. It'd be interesting to find out what their birth was like. So even when you look at what babies are exposed to in a normal kind of a birth, in terms of, is it painful? There's a lot of compression that goes on at birth, which is kind of natural. You see that, in nature all the time. Most animals that are born go through a compression, and then as they come out, there's an expansion. And the body's kind of designed for that. What's happened perhaps more recently, actually, this started a couple of hundred years ago now when the forceps were first invented. But there are other kind of forces involved with birth now, particularly to do with pulling. And pulling forces are used in a number of different kinds of births. Forceps, obviously. Suction is another one, where the suction cap is applied to the back of the baby's head. It looks a bit like this. It has a pump on it where you pump up the suction, and this is applied to the baby's head. This applies a lot of traction forces, pulling forces to the baby, which can really affect its neck and its head. You might have seen babies who are born with a kind of slightly, well, quite an extreme cone head, and it's often to one side. So this affects things like the base of what we call the occiput, the base of the cranium here. It affects the neck. And it tends to create these kind of reflex patterns in the baby to protect itself. So the baby will often do these sort of things. It will pull back through its back of its head. It will pull up on its tummy muscles to protect itself. And those kind of patterns can actually persist into childhood and even into adulthood if they're not treated. But in terms of pain, so a normal birth can be quite painful for a baby and obviously for a mum, but some types of birth are really kind of more painful than others, you could say. Babies generally like things quite slow, and that there are kind of reasons why labor tends to take a bit of time. We talked about the seeding of the microbiome. You know, as the baby comes down the birth canal, this is a very, very important thing, and that needs a certain amount of time. But also the baby's nervous system likes a bit of time. Their nervous system actually works quite slowly, so they don't tend to like things very fast. So what happens in an induced birth is that you don't get those kind of rest periods. So for the mother as well, in a normal birth, what you get is very, very intense periods of contractions, and then you get the endorphins come in, these natural pain-relieving elements come in, and you get a period of calm, and then before the next periods of contraction comes in. So this is also very important from the baby's point of view to experience that, because it allows the baby also to kind of catch its breath. Obviously it's not breathing, but it catches its breath through the umbilical cord, and it relaxes. Now, what happens in induction then is you get what are sometimes called jackhammer contractions. There's very little space between them. They're much stronger. So the baby gets much more compressed. Often it'll get compressed up against the mother's sacrum. So the mother's sacrum is here. This is the first thing really that baby comes up against as it comes down the birth canal. On a baby, it's often the left side here of its head. Here, it'll meet it. And in induction, this gets quite a lot of grief, actually. It's quite painful for the baby. So it's being jammed down quite fast. There's no space for it to relax. And everything is happening very fast. So that's what the baby will feel. It kind of feels out of control. Some people have said that being born like this is being a little bit like holding a baby underwater, allowing it up to breathe, but not letting it breathe, and then putting it down under the water again. It's potentially pretty brutal. So, because it tends to compress also the umbilical cord, so you can get elements of panic coming into the baby. Fetal distress is very common with induction, and that then can lead to other things, like other kinds of interventions, like this, like the ventouse, or even caesareans. So we talk in this book, and it's talked a lot about amongst midwives, as a cascade of intervention. Once you start with one thing, one intervention tends to lead to another. Induction is one of the main types of intervention that tends to lead to a mum having to have an epidural. And again, this is talked a lot about in the book. What are the pros and cons of pain relief, particularly things like epidurals? But there are other kinds of pain relief like pethidine, like gas and air. These are all talked about in the book. So that cascade of intervention might be an epidural, might be pethidine. And again, following on from that might be another form of intervention like ventouse, like caesarean. So again, when you read all the research about pethidine and epidurals, again, these have downsides. They can affect things like breastfeeding. Most mums don't know about that, but they tend to have an effect on breastfeeding afterwards. They tend to make the baby, or they can make the baby less aware, less or more sleepy right after birth, which is not a great thing. So it's more difficult for babies to latch on. And particularly, it can interrupt that whole period, which seems to be so vital, and this has been researched a lot. The first hour after birth seems to be very, very important for bonding. We talk a lot about hormones like oxytocin as the hormone of love, which is produced a lot in childbirth. It's produced a lot in lovemaking and other things as well. So oxytocin is produced in vast quantities at birth. And this, interestingly, has a very profound effect on initial bonding. So it's known to be important in initial bonding. And again, in induction, a mum is exposed to synthetic forms of of inducing hormones. So these are like synthetic forms of oxytocin. They're called pitocin or syntocinon. And these have a very, very different effect because they don't go through the blood-brain barrier in the same way that other naturally produced oxytocin does. So again, there are ramifications for this, which are discussed in the book as well. And oxytocin, exposure to oxytocin, seems to have an effect on later social behavior of the baby. And again, some of this research is quite difficult to get hold of, but it's well documented by Professor Sue Carter from the United States. She's written many papers about this. So this book really is designed to give some very, very positive and practical advice to mothers and healthcare workers about how we can really encourage a positive outcome for mother and for baby. So, for example, one of the things that is talked about a lot in the book is how to get the baby in an optimal, what is called an optimal fetal positioning. And a lot of the book is illustrated with cartoons to kind of make it a little bit more accessible, like here. So optimal fetal positioning is a term which means what is the best position for the baby in the womb? What's the easiest position for it to be born in? And this is often the left side of the mother and the back of the occiput towards the left side of the mother. So there are various things that a mum can do to encourage this. So nowadays, many babies are born in a posterior position, or what are called back-to-back. And this can be quite a problem, actually, because the baby has to do much more rotation. It can be much more painful for a mum, it can be more difficult for the baby as well. So in the book, we discuss how exactly it's possible to encourage that position through things like osteopathy, Bowen, craniosacral work, acupuncture, as well as simple things a mum can do, like how she can sit better, how she can move or exercise to encourage an optimum position for the pelvis for the baby and for her. Another thing the book talks about is how important it is to have a good emotional attitude and how this tends to affect birth outcomes. One of the things that we want to stress is that if a mother is anxious, that tends to have an effect on things like the sphincters in the body. It's very, very difficult to relax if you are stressed. And they often say that hormones like adrenaline, which is the fight or flight response, part of the fight or flight response, and oxytocin are a bit like oil and water. They don't go together at all well. So, it's a bit like a seesaw. You have either, if you're too stressed, you're not going to be able to relax and really allow the body to get into what is sometimes called labor land, where the body is flooded with things like oxytocin, and the various sphincters can really open and relax. We discuss things like hypnobirthing. Being prepared seems to be very, very important. So going to good antenatal classes where it's really explained. Yes, there is a lot that mums can do, actually, to make them less anxious during pregnancy and particularly around birth. I mean, I suppose one of the things nowadays is that, the media bombard us with horrible images of birth, and particularly. So we have to kind of counter that a bit. One of the things that seems to be really, really important is preparation. So learning about things like breathing, positioning. I mean, just knowing simply that it will probably be more painful if a mum is lying on her back than if she is able to move around or squatting is something that's pretty basic, but unfortunately in a lot of hospitals still, lying on your back to give birth is still the preferred option for some reason. Obviously this is something that is covered in antenatal classes, but the problem is now that antenatal classes have been cut right back to very little. I mean, in our county in Dorset here in the UK, mothers are given one antenatal class, or offered one antenatal class of 3 hours only. And that's just not enough time to really go into the whole details about it. So preparation, things like hypnobirth or going to NCT classes, National Childbirth Trust classes, there's various other people, or even having a doula. Some people don't know what a doula is, but a doula is a sort of companion, usually a female companion that can come in and support the mum during the later stages of pregnancy, and particularly at the birth, sort of to act as an advocate for her. And doulas have training. It's not quite as extensive as midwives, although you do get a lot of midwives now working as doulas. And that can be tremendously helpful. I mean, it's often said, you know, if you don't know what the choices are, then you don't have any choice. And unfortunately, that's very true. And I mean, I can understand hospitals, even midwives have a very tough time. They're very, very, very busy units. Unfortunately, certainly in the UK, they're understaffed. They're under a huge amount of pressure. And understandably, they don't have time to explain all the ramifications of all these things. So yes, I mean, some of these decisions are incredibly difficult, especially when you're under pressure, and I can quite understand that. So this book is all about being prepared, and sometimes it's a question of asking for more time. Hospitals are they're short on time, but you can ask, for example, a midwife colleague of mine uses the acronym BRAIN. So what are the benefits of this intervention? What are the risks of it? What does my intuition say? What are the alternatives? And one of the alternatives might be, do we have more time? And just giving that extra time can sometimes, mean that you don't have to have this kind of intervention. So it's all about information for a mum. And unfortunately, mums just don't have that information. So if you knew, for example, if you had the option of induction, and you knew that if you're given synthetic oxytocin, which could be syntocinon or pitocin or whatever, that doing that would lead to double the chance of your child becoming ADHD, you might think again. And you might ask, is this really necessary? Do I really have to do this? Can we have a bit more time? Are there alternatives? So this is the sort of thing, these are very, very, very difficult areas, and I don't want to play down the difficulty of these choices. They are very, very difficult, because often pressure will be put on by people in charge, and they might be real risks, that if you don't do this, okay, your baby might be in risk. But quite often it's not the case. It just needs a bit more time. And so that's just one example. There are many other examples. Will this affect my breastfeeding? Will this intervention affect my baby's later health? Some of the things we talk about in the book are quite structural. If you have an intervention with forceps, if you have suction, what's that going to do to my baby's head, literally? Is it going to cause distortions in the jaw? Is it going to distortions in the neck, which then maybe might need later treatment through things like cranial osteopathy or craniosacral work or Bowen, whatever. Some of those are more subtle. Some might be other ones which we can't really we don't know what the implications are in terms of their psychological and emotional health later on. That's something that is only just now being studied through pre and perinatal psychology. So you can get this book through any good bookshop, also through Amazon, both as a paperback and as a Kindle version, through our own website, which is cyma.org.uk.